I had been told that radiation was easy compared to chemotherapy, so it was with a celebratory feeling that I followed the blue line down the long, low-ceiling corridor in the basement of the hospital to meet with my radiation oncologist. As I waited in the exam room, I began to daydream about what my life would be like with cancer behind me in only a few short months. I could see the sea of mountains waiting to be climbed stretching out before me. I could almost feel the vertigo that comes from being high up on a granite wall, my forearms tight, fingers weak and aching, my lungs straining against my ribcage with exertion as I push higher and higher. The door suddenly opened, and there was my oncologist. We exchanged pleasantries, he flips open a manila folder, and we spend a minute or two talking about chemotherapy and my experience of it. Then he launches into a monologue about chest radiation that I know he's done 1,000 times before. I pick up bits and pieces, but one phrase stands out: scarring of the lungs. I interrupt. How much lung capacity could I lose to the scarring? Will I be able to breathe okay at higher altitudes? Well, it's hard to say, but considering the size of the mass and its placement in a thoracic cavity, the scarring could be substantial. You probably would not be able to go to high altitudes without having some difficulty breathing. I am standing up and slowly putting on my jacket as he looks up at me with a shocked and confused look on his face. Where are you going? I'm going home. I don't think that radiation is for me. But it's part of the protocol. Doing it will decrease your chances of recurrence to less than 20%. I know, but I need my lungs. A week later, I'm once again walking the blue line of the basement corridor to the exam room. I had already made up my mind, but he had made the effort to call me at home and sounded earnest when he said I should come back one more time to finish our discussion. I just want to make sure you have all the facts so that you can make an informed decision, he says as he closes the door. I can tell he's much more prepared this time. Attached to the manila folder are pages and pages of important-looking research papers with lots of tables and graphs. He begins to read me some numbers from a table, and then starts explaining a graph before I stand up and pull my jacket from the chair. No, wait, he says. I pause with one arm through my jacket. Slowly, he puts down the manila folder and stack of papers on the exam room counter. With a deep sigh, he takes off his glasses and rubs his eyes, pausing with his thumb and forefinger on the bridge of his nose. He drops his hand, and when his eyes open, the look on his face slowly changes. It's a look of recognition, eyes widening slightly and getting brighter, as if seeing me for the first time, as if some thin curtain between us has been pulled aside. Michael, I remember reading an article once about a blind man that climbed Mount Everest. What makes you think you couldn't climb Mount Everest with a smaller lung capacity? Stunned, I stand there for a long moment, jacket hanging from one arm. And with the curtain drawn, I recognize him too, climbing his own mountain. I slide the jacket off my arm and drape it over the chair. You're right, Dr. Balog. I've always liked a challenge. We both sit down and begin to talk. We talk like we are sitting on the floor of my apartment, surrounded by topo maps and climbing equipment, planning out our next adventure.